Hello, my name is Gwendolyn Joy, and this is week 3, and this is my video on the article of biomedical stability analysis of a standalone cage, the static and rotational dynamic plate, and a 2-level cervical fusion construct. So within this article, I will be discussing this video, I will be discussing the article's standpoint and also my viewpoints of where I believe this research can have been done a bit better to help with today and continuously modernize science. So again, just like science, medicine is constantly evolving and finding new ways to improve the methods that we use, the technology that is assisting us, as well as the biomechanics used, as in the tools. So that being said, with those new tools and involvement within medicine, it helps surgeons as well as anyone else in the medical field to provide better care for their patients. So within this article, it spoke on the studies of the use of cadavers in the spine fusion of standalone cage, the static plate, and the rotational dynamic plate of the 2-level. The article also speaks on how the development of the methods has changed, but also just the slight differences within the three. So in the article, they use cadavers, and with the 3 different methods, it shows the differences on the results of the C4 to C5, and then the C5 to the C6. And that is where within the spine that they placed or did the procedure. From the results, there was some differences, but nothing to particularly jump out and state that one of the methods was better than the other. But that's also based off of the immediate after, they're getting these results immediately after they've completed the procedures, not allowing the body to fully have time to adjust and see what did or didn't move, if there's more mobility versus less, from the period of the completion of surgery to whatever time period that they chose to do in the gap in between, which kind of helps me go into the point where I believe there were definitely big and large benefits and success, things that I believe that this study showed, as in how, because they used cadavers, there wasn't any negative or possible negative impact on someone's life due to less mobility, or if there was an increase in their pain, or they had less range of motion, again going back into their mobility. That was great to see that they didn't cause any harm in that, but we can't tell, again, because we only know what happened immediately after surgery. So cadavers can't provide verbal feedback, because again, they're cadavers, they're not alive, versus whereas a human can at least state, hey, this is my pain tolerance, I have this type of ability, there's different aspects that a person can provide post-surgery, and then within the years to come, they can say they can choose whatever time period they choose to have in between a follow-up. So if they wanted to do a follow-up, 1 month post-surgery, and then proceeding up until a year and years after, they can go a month, 3 months, 6, 9, and then a year. And then after a year, they can do a yearly follow-up for however long or little they choose. But again, that allows that person to have a better feedback, because then they can go back and look into those notes of saying, hey, on this day for this time period, I had these issues. Either I still have those issues or I no longer have those issues, which again just allows the surgeons to be able to make and better analyze, one, the way that we're going to be using the surgery for their upcoming people. So if they need to critique, or if they need to completely not use that method of procedure. Another way that this article kind of helped show and provide that the techniques, because again, there's limited use of humans and there's limited use of feedback, we see the feedback provided again immediately after. But once we see that, again, the surgery is meant for people that are alive, and so they need to know, the surgeons need to know, hey, if you're this age, this probably would work better for you versus this one, because some people can live with having limited range. But for someone that's still active and that wants to be able to do things, having a surgery that's going to potentially limit to them would not be effective for them in their lives, causing them to potentially, just decrease in with their energy and just lessen their morale as a human, which is never what anybody wants after having a surgery that's supposed to help better them and allow them to continue living their life. So that is my feedback and my perspective on the study. I think it was a great study. I just wish that they would have used, after the use of cadavers and finding out where they should proceed with the procedure, they should have then also see and analyze, if they're going to continue to use cadavers, analyze after a period of time the range of motion and the the rotational use of the axles, versus where in humans, again, they're going to be living with this for who knows how long, and so they need to be able to pinpoint if this surgery is worth them having, but also is it worth them having that particular surgery, because one could be better than the other. Again, they also just need to know the side effects of what potentially could be happening after that surgery. Whether if it's going to take them months to be able to recover. If you have time to recover months after the surgery, great. But if you don't have time to recover, or if you need, you're like, I need time to wait a year or so before I have the surgery because I have these certain things that I need to do. That's just something, again, that as a patient they need to know, but also as a surgeon to be able to provide that feedback and speak on those, so that way they can actually have conversations instead of the surgeon just saying, this is what we're going to do. There needs to be some type of dialogue, as well as knowledge of what happens post and pre-surgery. And that is my take. And I will attach, I have majority of what I just stated. There's a couple of things I'll probably annotate again, if you would like to see my, what would this be called? My monologue, I guess. Have a great one, and looking forward to the upcoming weeks. Bye.